Well, I want to say good afternoon, and I want to thank you all so much for joining this call. And I'm actually going to record this so that we can have this for future resources or references. I want to basically introduce you all to Emily Potts Hill. Emily Potts Hill was our coordinator for many, many years, and she pretty much was involved from the beginning stages of the Comfort Care Coalition. So I'm so excited that she's willing to take this time to devote to us and just share with us a little history about the coalition. What I'm asking everyone to do, if you all have any questions, what I'm gonna do is I'm going to just basically, if you just mute your line, and then we'll have like a question and answer session after Emily gives a presentation. If like me, sometimes I have a question and I can't remember. We do have the chat room available, so if you all want to, put your questions into the chat room, or if you're very bashful and do not want to ask questions, I'll be happy to ask those questions for you all. But I'm very excited that once again that Emily has taken out this time to just meet with us all. So with no further ado, I'll just hand this over to Emily.
Okay, Kevin, you all have to excuse me. This is the second Zoom call I've ever done. So, um, Kevin, I'm seeing the Stargazer logo and you. Is that what I should be seeing?
Yes.
Okay.
Mhm.
Well, all right. Good afternoon, everyone. I'm actually looking forward to meeting new board members, which hopefully I'll have a chance to do towards the end of this presentation, maybe, Kevin.
Mhm.
Um, so, in terms of history of the Comfort Care Coalition, everything really started with the Robert Wood Johnson Foundation. In 1995, RWJF did a clinical trial called the Support Study that looked at end of life issues and hospitalization issues for people because they were under the impression that the system wasn't working very well. This was a controlled trial with the intervention being both information for physicians and a nurse practitioner who communicated with families and staff and physicians and patients with the intent of improving the care of the patient and helping doctors understand what it was that the patient and family wanted. That was a 2-year study. It was controlled. There was a group that got the intervention and a group that didn't get the intervention. And the sad thing was that at the end of the 2 years, it was very obvious that there was no difference. Nothing changed. Patients were still dying in pain. They were living in pain over a period of time in the hospital. The amount of CPR didn't change. The pain level didn't change. So what Robert Wood Johnson decided was that there needed to not just be an intervention, there needed to be a culture shift within the entire country around end of life care. So what they did was to start an initiative called Last Acts that was intended to provide materials for healthcare providers and to help healthcare providers create materials around palliative care. About that time, they also funded, you may remember the Bill Moyers series on our own terms. Kevin, you're considered the conversation is very similar to what that mini-series was. It was a 4-night mini-series, a 4-week mini-series that interviewed care providers and patients and families and looked at what the situation was like in the hospital and in end of life care in the country. out of that, people in the community started calling in and saying, how can we get involved with this? So a second initiative called Rallying Points was founded. And that was where we came in. That was where we were born. Some of you are probably familiar with the University of Tennessee College of Nursing Cashdollar Distinguished Professor Lectures. This is an endowed lectureship through the College of Nursing at UT Memphis that was created when the wife of a Mr. Cashdollar, the man's name was actually Cashdollar, wanted to help healthcare providers take care of patients who were dying better, in a more effective way, in a more loving way. And so Mrs. Cashdollar provided money to the College of Nursing to do an annual lecture to help healthcare providers learn more about palliative care. When her husband was dying, his ability to communicate decreased, and providers couldn't understand him well enough to give the most appropriate care. So those lectures have been going on for a number of years. And in 2002, the Cashdollar Lecture brought the co-founder of the Western Regional Resource Centers for Rallying Points to do a presentation for the Cashdollar Lecture. There were 3 regional resource centers for Rallying Points, one in the east, one in the west. The one in the central area was focused on bioethics, where the other 2 focused on palliative care. And so the Cashdollar speaker was Barbara Spring, who called us before the lecture and said, Robert Wood Johnson is starting community coalitions throughout the country. And I would like to stay an extra day and help you create one. So Barbara talked about community and palliative care and how the community could become involved and support the palliative care process. And people became really, really excited. The people at that lecture met afterwards, and she had several brainstorming sessions. People met, and we're told that there would be an additional session on Saturday, which was the next day, to start this coalition. Now, we're talking 2002. There were no freestanding hospices in Memphis at that time. And so the people who were interested met that next day and then began meeting actually on a monthly basis to plan what the activities of the coalition would be and to start having programs. So in 2004, the coalition got nonprofit status, and for quite some time was actually doing monthly meetings, and then we went to bi-monthly and finally to quarterly. The goals of that initial Comfort Care Coalition, as it was originally formed, were to build a broad-based community network, to maintain a speakers bureau, to provide community education via literature workshops and symposia, to inform the community via speakers, media, and the arts, and to secure ongoing funding. Throughout the coalition's life cycle, there have been a number of conferences presented, the first of which was an outgrowth of the Rallying Points initiative. Robert Wood Johnson would give a coalition a free speaker off of their speakers list to come in and do a conference. So the first conference that we did was something that was kind of reverse of what you'd think. It was a listening session. It was entitled Matters of Life and Death, Advancing Excellence in End-of-Life Care. We brought in key people from across the community, professional people from hospice, from the hospitals, from different community organizations, people at high levels of authority in those groups to listen to the audience in terms of what they felt the needs were around end-of-life care. We took that information and wrote up a report and presented that in a second conference, for which the keynote speaker was Dr. Kenneth Robinson, who was at that time the Tennessee Commissioner of Health. So additional conferences over the years have been in 2008, one that was entitled Creative Passage, Honoring Life and Encouraging Hope. And that focused on the healing power of the arts. So we had people to come in and do storytelling and do graphic arts and do music and talk about how those things could be used with people at end of life. Then in 2010, we did a conference that was funded and co-sponsored by Santa Fe of Venice, entitled Living, Loving, and Dying Well. That was done at the University of Memphis. And then finally, in 2014, and this was after we had merged with the Bioethics Center, and I'll talk about that in a minute, we presented a conference that was entitled Mapping Personal Healthcare Decisions for Your Life's Journey, again at the University of Memphis. Now, about the Bioethics Center, the Bioethics Center, the Comfort Care Coalition really had both healthcare providers and consumers. We always wanted a heavy consumer component, and yet the provider component was really, really important. The Bioethics Center was a separate organization that was also incorporated to look at the needs of and the ethical issues for healthcare providers in the professional setting. Their goals were to promote communication on issues of biomedical ethics through public meetings, symposia, and other group activities, to educate members of the institutional ethics community and committees, to act as a resource for the community by maintaining a list of interested persons and their expertise, to seek grants, to provide a forum for discussion of policy changes, and to build community awareness of bioethics issues. They were also doing periodic meetings with a dinner and a speaker, and brought a lot of key ethics experts in for those presentations. Over a period of 2 years, the Bioethics Center held regular meetings to work on making the end-of-life care and advanced care planning issue within the hospitals more consistent across the facilities, and they brought representatives from each of the main hospitals. The Comfort Care Coalition sent 2 representatives to each of those meetings. Throughout our history, we worked and collaborated with the Bioethics Center on a number of things. Another thing that they did was to create a quote, inappropriate end-of-life intervention policy for the local hospitals. which sometimes is known as fetal care policy. That is, in a situation where no aggressive care is really going to improve either outcome or quality of life. We collaborated with the Bioethics Center on a couple of occasions. There was a first conference for Cashdollar that we collaborated and with the Bioethics Center and co-presented a Cashdollar lecture on older adults and the needs of older adults around end of life. So in 2014, well, actually in about 2012, the Bioethics Center decided that they were going to give up their not-for-profit status, and they cast about for who would be best maybe to pass some of those resources on to, and they settled on the Comfort Care Coalition. So we worked together with them over a period of 2 years, deciding how this handoff would be done. And in 2014, actually merged and went through the process of changing the name and changing the not-for-profit status and coming up with new objectives that would address both the bioethics component and the community component that the Comfort Care Coalition had always done. I know you guys have made some changes since I've not been involved in terms of the bioethics component. But what we built and what we created was a very broad-based coalition that could address issues in the community and that could also address professional and bioethical issues. One of the key things that we did, and as I understand it, Kevin is doing now, was to provide a forum for people who needed information right away. And for many years, I took those calls. People would call asking about nursing home issues, about caregiving issues for their loved ones, about pain. And I sort of did triage where I would hook them up with the most appropriate person. If I couldn't answer their questions, I would hook them up with the most appropriate professional. So that kind of brings us up to where we are, to where we were when I left as coordinator. And I'm so excited to hear that you have now someone who is going to pick up that mantle. Part of what that coordinator does is to keep a finger on the pulse of everything that's going on in the community. Often attend not only all of the Comfort Care Coalition's meetings, but other meetings in the community to know what's going on and to be able to provide information. Another thing that we did was to solicit partnerships with organizations, and that has, you have to stay on top of those, because when staff changes within an organization, then oftentimes the organization will not even be aware that they are partnered. So that's something that needs to be kept on top of. We have had partnerships with various churches, with various hospices, with St. Francis. So part of the nature of the partnerships, if they were originally envisioned, was that we would provide what services we could for our partners, and they could provide us with either speakers or cash donations or in-kind donations. They could write for the newsletter. again, ways to incorporate and spread that network. The, the key for the Comfort Care Coalition has been networking and community involvement. And I'm really excited hearing some of Kevin's plans to know that he is expanding that. So, with that, I think I've provided about all the information that I have. Kevin, do you want to pick up?
Well, first of all, that was great.
Well,
So
I'm sorry, I was nervous. This is Zoom thing. I've told you I'm not a um,
you did great.
technology person.
You did great. You really shared some things that, especially I'm really big on the visual arts. And just yesterday, I saw the expression on Virginia Space. We had a meeting yesterday when we was looking at the partnership agreements, and I kept saying, what is it about, what is the arts? And you have fully explained to us that we had partnered with the arts community in order to really do some storytelling. I think that's brilliant, and I got goosebumps because I really would like to bring that back, So thank you for sharing that. But one of the things I wanted to that Emily has really shared with me and really have put back in my mind, is that we really need to continue on with the networking, and you're right, expanding our network so that people within the community and outside this community can be fully aware of what the Comfort Care Coalition. And I do feel very confident that the board and people that we're reaching out in contact with, we're really truly making that happen. And so it's really nice to see that there is a little energy, that is coming from everyone really taking, really want to be a part of this. And even this morning with our meeting with Alston, I mean, he was really, passionate and driven to do more for the coalition from the bioethic center. So I'm just really excited that we have so many things that are cooking, and eventually I'm going to serve it to everybody at my dinner table. So that's where we're at right now. So thank you so much for sharing that, because that is such a good history that's been very helpful to me, and of course the people that are on the call. Before we move on to questions and answers, I do want to take a moment to recognize who's on the call, which I should have done that before. Um, of course, the first person that I wanted to know who's on the call is Lauren Van. Lauren Van is the new volunteer coordinator. So Emily, she's pretty much taking charge of what you used to do along with me. But Emily, Lauren is very energetic. She brings a lot of great ideas to the Comfort Career Coalition, and I mean, she's just been remarkable for us to have. So I wanted to make sure that you first know who the replacement is and get a chance to, talk with her. And I'm sure I never shared this with Lauren, but if Lauren ever wanted to reach out to you, Emily, for just, sharing the thoughts of ideas, I'm sure that you're pretty open and allow her to do so, you know. The next person I want to introduce is our brand, I guess you say, spanking new board member, and that is Miss Jacqueline Owens. And Jacqueline Owens comes to the board with lots of experience. When she told me a couple weeks ago, I knew that she had an RN background, and she's also has a social work background, but she's currently working on her PhD, and I was like blown away. So I'm very, very, very excited that we have Jackie. And, Jackie just joined our board within the past month. Jackie, it's been a month, going on a little over 2 months now. And
yeah, in July.
in July, and so she's already, I already have her involved in a project, so I'm really excited to have her on. And then of course we have Shanitra. Shanitra is the intern student that has been interning with us this is her third week. And so she's been really working very hard to do the resource guide. And then of course she's getting her degree is going to be in social work, so she's working along with Jackie And Jackie is just sharing her those social work skills and principles to help her be very successful for the future. So I'm really excited that we have her. And then I have to brag on this other person that I call her. She's kind of like my rock. I call her all the time because she always gives me such great encouragement, and she makes sure that I stay in the right direction. That's Miss Virginia. She's just so wonderful to me, to put up with me sometimes on things that I come up with. So
Well,
I'm very excited.
It's a tough job that somebody has to do it, right, Kevin?
But thank you for that. So now when I
work with.
oh, thank you. So, but now I want to open up questions and answers. This is a perfect time, and Shanitra, I know I've told you over and over the past 2 weeks, that's a good question to put on your list to ask Emily, So I know that we have a couple of questions that Emily, that we want to take this moment to ask you and just really, get started. So who would like to start first with questions?
Well, this is not a question, but just thanks, Emily, for doing this. I've heard this a couple of times now, and I got more out of it tonight than ever. And it was absolutely the first time I realized that Cashdollar was a person's name.
Mm.
I always thought this was some kind of group that I knew nothing about, and it was just clear and logical the way you went through it, and very helpful. So thank you for that.
Well, you're welcome. And I do want to say that I looked up this year's Cashdollar information.
Uh-huh.
And the keynote is ethical and human challenges for coping with COVID-19. And that's going to be done by the Director of Education for Seattle Children's Research Institute. It's a Zoom call, and they'll have a panel that will include Dr. Justin Baker from St. Jude, who is their Director of Palliative Care and Quality of Life. And then they have an ICU nurse, a family caregiver, Director of Palliative Medicine at University of Tennessee, and a chaplain from Baptist. And it's a Zoom call.
Yay.
So anybody that wants to participate can get in touch with Royland Germain at UT at 448-2726.
Yeah, that'd be great for me to reach out to see if we can share that on our next newsletter or e-blast that we send out, because I definitely would like to share that information and also attend that. Would be very helpful.
Hi, Emily. This is Angela. Very good to hear from you. I enjoyed your presentation as well. And so we've learned a lot today. So thank you very much.
Angela, you was hiding. You was hiding.
I know. I know.
Oh, I'm so glad to have you here too. You was hiding my screen. I should have clicked that little drop down to see who else is on here.
Oh, that's okay.
Awesome. Thank you.
Mm-hmm.
Emily, this is Jackie. And as Kevin mentioned, I'm new to the board as well, so I'm learning a lot about the coalition as well. And so I appreciate the history that you shared, and just awesome to be a part of this organization as well.
Jackie, are you from the VA?
I am. Sue Stevens I basically am filling in the remainder of her term. She was my chief in social work, so I was really honored to be recommended to complete her position on the board.
I was going to say, that's another go-to person for you.
Mm.
Yes, she's an excellent mentor as well. Thank you.
Mm-hmm.
Okay, Shanitra.
Well, Miss Emily, I want to say I absolutely enjoyed it. But Mr. Jones, she actually answered my question that I had.
Good.
So I don't have a question.
Okay. Well, I have one. Emily, can you share with us all throughout these years of, really putting the Comfort Care Coalition at the forefront, what has truly been your passion? What has really inspired you to do this work? Because sometimes you have to really reflect back on what you're doing to continue to stay motivated and continue to be inspired to do this work. So what was something that inspired you to really push the Comfort Care Coalition within the community?
Kevin, I worked way back when on a federally funded nursing home study.
Mm-hmm.
And we were looking at mental status and mood and activities of daily living over time when people were first admitted to a nursing home. And it was a quantitative study with lots of check the boxes. It was long. And I interviewed everybody that came in the facilities that I was assigned to. And I would recruit them, and then I would ask them all of those very dry questions, which they would answer. And when they got to the end of that, they would tend to say, I've lived a good life, and if the good Lord wants to take me, he can take me in this bed, he can take me in this chair, I'm ready to go home. And I didn't prompt that. Those people would typically tell me that. Or flip side, sometimes they would be scared and they would be upset and going, why did my family do this to me? So they would just need to talk, and they would talk and talk and talk and talk. It just pointed out to me what the needs are in that setting and also with older adults in general. And then the AIDS patients started coming. And I did I did 2 studies in the nursing home, one with people with terminal cancer and one with men with HIV/AIDS. And that motivated me so much to want to, that was what kicked me off into this whole work, to want to find ways to comfort and support and improve the situation for people who are facing quality of life issues and quality of end of life issues.
That's awesome. That's really awesome. I think if you reminded me, I believe that all of us that have been doing this work, we can really recall a situation where, even if it was a family or being with a patient, where you really get, when I used to work with a hospice and I'm at the grocery store and I have my name badge on and people would stop me and say either 2 things. Oh, hospice was beautiful. I wish that I would have known about it a lot sooner, or you have those people to say, you know what, how can you do that work? It's very sad and depressing, and I always respond to them and I say, no, we're not in the business. We're not the Grand Reaper. We're basically here to make sure that everyone receive a higher level of care and have a quality of life. And that's what I'm doing to improve that. And I know anytime I hear a family to say that I wish I would have known about the service a lot sooner, that gave me motivation to do a better job of educating the service to the community, where I can really turn that around, where people can start saying, I loved hospice. I was so great that we received it at the right time, and that's very impactful when you hear families say that. So you're right. It's the people that share their stories, and then through their stories, you're touched and you realize there's more that can be done. So I get that. I get that a lot, Lauren, do you have any questions?
Sorry, I was trying to get off mute there. Well, I definitely want to say, thank you so much for sharing. Like everyone else has said, I feel like this helped me understand so much better. And I'm so thankful that we were able to do this and listen to everything you had to say. I don't have any questions, but I'm just, excited to let you know that I'm, looking forward to assisting the board to keep things running and, so we can definitely continue to, carry out this wonderful mission within the community. So thank you.
You're welcome. And Lauren, please feel free to contact me at any point. I gave Kevin a jump drive that had all of my files on it. And just right as I was scurrying around trying to get ready for this call, the old computer that was on messed up. So I don't know if I can get that back or not, but Kevin has those files. And there are a lot of things on there, like, for example, a certificate of attendance for presentations and the like. So there are resources that we have that it may not be easy to find. You might need to call me up or email me and say, I'm looking for XYZ. And I can either, if I still have it, email it to you, or I can tell you where to find it on Kevin's jump drive.
Wonderful. Well, thank you so much. I appreciate that.
You're welcome.
Well, if there's any other questions or feedback at this moment, please share. Well, I would like to say once again, Emily, thank you so much for doing this for us. This has been a really great program and presentation. And guess what? I'm going to post this on Facebook. I'm going to post this through our podcast. I'm even going to take it to Twitter, So thank you so much for sharing this time. And this has been really helpful for me, and I'm sure for others. So once again, I just want to say thank you for doing this for me.
Kevin, you're so very welcome. I am so relieved that you are in position and that you have these great new board members and that you now have a coordinator. I can breathe easy now. Thank you.
Well, I want you to continue to breathe now.
Right.
Yes, yeah, we have a really good group, and I say this a lot to everyone. I have been so blessed to have all these people that have been willing to, join me in this, and really continue to make this awareness, about end-of-life care. And so everyone, I think I pinch myself sometimes. I can't believe how smoothly things are working out with the people that we have that are involved. So it's been really, really great. Really, really great. So, well, I hope that you all have a wonderful evening. If you all were nearby, I will have you all to eat some of this chicken spaghetti that I cooked the other night. But since you all are not, I just enjoy the whole thing myself. But I'm joking. But I just want to say thank you all, and I hope that you all have a wonderful evening, okay?
Okay. Thank you, Kevin. Thank you.
Thank you.
Thank
Bye-bye.
you.
Bye.
Bye-bye.
Thank you.